All right, let's get started. Hi, everyone. My name is Brianna Gonsalves. I'm with the Managed Care Technical Assistance Center, Miktex, and you are joining us today for tips for completing the Managed Care Organizational Self-Assessment webinar for critical access providers. Before we get started today, I want to take a moment to orient everyone to the WebEx system so you know how to best participate in today's event. So please note that upon joining the webinar, your microphones have been put on mute. So the best way to participate in today's webinar is to contact us via the chat box, which you can activate by clicking the dialog bubble on the bottom of the PowerPoint slide deck. It should be orange if you have not activated it yet, and then it should appear on the right side of your screen. And you can use this chat box feature to submit all your questions, and we encourage you to submit questions throughout the duration of today's webinar, and we'll respond to them during the Q&A portion at the very end. And I also want to let everyone know that the slides will be posted online. Since this is a closed webinar, closed community, very targeted to critical access providers, it will not be searchable on our website, so you will be receiving a unique link for this webinar in the next 2 or 3 business days. And so we'll make sure that that is available to you all. So I also want to mention that we will be having office hours in 1 week from today to answer any outstanding questions that you have about the Managed Care Organizational Self-Assessment. So today's presenters are myself and Dr. Andy Kleek, who is also part of Miktex. He'll introduce himself shortly. And we're also joined by our state partners who will also introduce themselves upon entering the webinar. And a quick overview of today's presentation. We're going to talk about what is Miktex. We're going to talk about, we're going to provide an overview of the critical access providers funds and activities. And then we'll really dive into the assessment, really orienting folks to the survey, logistics and recommendations that we have, and really provide some more context around Miktex experience using organizational self-assessments, and then we'll also introduce you to some tools and resources that we have around the assessment so that everyone can successfully submit it by the deadline, October 12th. And then we'll really just provide, again, another brief overview of the timeline and our next offerings. So with that, I'm actually going to pass it to Dr. Andy Kleek to give us a bit of an overview around what is Miktex.
Thanks so much, Brianna. I'm Dr. Andy Kleek. I'm the Chief Program Officer at the McSilver Institute for Poverty Policy and Research at NYU, and I'm also the Director of the Managed Care Technical Assistance Center. I will keep this very brief. The Managed Care Technical Assistance Center, or Miktex, provides training and consultation and educational resources to all mental health, substance use, and child welfare agencies in New York, both adults and children's agencies. And we have been doing this since 2014. We also operate something called the Community Technical Assistance Center, or CTAC, which has been working with children's mental health clinics in the entire children's system since 2011. And we really work with folks to kind of really just adapt to all the changes in Medicaid and in healthcare in the Medicaid system in New York State. So we're really excited to be part of this webinar and part of this initiative, and I'll be back in a little while to talk about some more concrete things as well. Thanks so much.
Hi, everyone. This is Claire Rudolph with the Office of Mental Health. I've been emailing with a lot of you back and forth, so thank you all for joining today. So briefly, one of the biggest questions that we've received through our mailbox is, sure, I'll participate in this, but what is a critical access provider? Is that a formal definition? And the answer is we are using the term critical access provider for this Readiness Fund initiative to mean the current OMH Intensive Care Coordination, or ICC agencies, and the OCFS Healthcare Integration HCIAs those are, if you're not one of those, let us know, but that's the group that we targeted for receiving these funds. And we're really hoping that these funds will be used to help assist your agency in the transition to Medicaid managed care. On the next few slides, we'll go through some of the key deliverables in addition to the readiness assessment that we're really focusing on in this webinar today. But we're really hoping that we can be innovative with these funds and that they can be used to really support your agency in this transition. So the next slide will show the key deliverables. So in addition to emailing the OMH mailbox to say, yes, I agree to participate in this, and let us know who from your agency is going to be participating. It can be staff and or consultants. We just want to know who the main contacts are. So a lot of you have already emailed and let us know, which is great. If anybody registered for the webinar and has not emailed the OMH mailbox, please do so we can keep track. That's number one. So in addition to that, you'll also need to attend this webinar. So good job if you're on. And then, of course, complete the managed care organizational self-assessment. And we'll get into the details on that during this call today. The results of that assessment are going to be used to inform the trainings that will happen through the month of November. So right now, we know that we're doing trainings in November. We are still discussing the best mechanism for that, whether they'll be small groups in person throughout the state, but what we do know is that the content will really be driven by the results of this assessment. So we're hoping that you and your agency's leadership will be able to work together as a team to complete this assessment so that we can have, trainings in November that are really meaningful and that are really helpful. Based on completing the assessment and participating in those trainings, we'll ask that you complete and submit a strategic transition plan. We will be sending you the template for that in a fillable PDF format along with the first payment that you'll receive. So that's not something you have to make up on your own. We'll have a template for you. And then with the remaining funds that are left, we'll ask that you start to complete some tasks and activities that help support what you've outlined in your strategic plan. And we'll get a little bit more into the strategic plan later, but that is it for now.
Okay, so I'm just going to talk a little bit very quickly about Miktex Role in this process. So our big role today and in the next month is we are going to coordinate and organize and ultimately analyze the managed care organizational self-assessment that everybody completes. We'll talk about this in a little more depth, but not only are we going to, and I'm going to thank Brianna and Patricia and a number of other people on our staff for helping to coordinate. We're going to coordinate all this in the background. So we're sending out the assessment that you've all received. We're going to manage all those emails. We're also going to analyze all the information that comes back. One of the things I just want to highlight, and we'll say this a couple other times, but you as an agency will also get this information back for your own agency, so you have a sense of how you did. This is not one of those situations where you send this assessment into some black hole and you never hear anything back. You'll get an individualized report to your agency, and once we're done with the analysis, we'll be sending that out to everybody. One other thing just to highlight here, because we've done a number of assessments and this one's a little different because of the nature of this assessment and how it's connected to funding, your information will be shared with the state, which is often not the case where we keep that information confidential, but it will in this case be shared. A couple other things just to highlight, we're also going to coordinate and develop the in-person and web-based training. As Claire mentioned, that training is still a little up in the air because we are going to wait to design the training until we actually get these assessment results back so that we can tailor it individually to agencies. But a couple things just to highlight, there'll probably be a blend of in-person and web-based training. And I think, and also a blend of group-based and some more individualized training, and really helping agencies think through kind of what their role and what their strategic plan is going to be in this child transition and what steps they need to take and how they can use this funding to make that the most effective. Okay, so just to talk very, very briefly about what the purpose of the OSA is that, and we're going to go through some of the individual domains, but really the idea of this is for you to get a very, very concrete sense as an agency and an organization how prepared you are to make this transition to managed care, and where you stand in that transition, and how, whether or not you have other operations within your organization that have actually already made this transition, how does that all fit together? And also, so it's two or threefold. So one is to give, the most important is to give you as an organization idea of where you stand around critical areas that are important for the transition to managed care. Second is to give us an idea about kind of the TA and how it should be structured and what are the areas of real priority, the areas of real need. And then third, third as well, is also give the state an idea of where this group of organizations stands in terms of their readiness for the transition to managed care, and how all that, how all those different pieces fit together, so that we can all collectively work to make sure that folks are as ready as possible for this transition. I think one thing, and Brianna will mention this as well when she talks some of the specifics about the assessment, I think one thing just to do, this is not the assessment to send to whoever fills out forms in your agency to fill out by themselves. This assessment is broad-based. It covers a lot of ground in your organization. And so really what we recommend you do for this is to pull together a team that includes senior management, program leadership, IT leadership. The IT leadership is really important here because some of these questions are specific to your IT system. IT leadership and finance staff, and then to the extent that you have quality assurance and program evaluation staff, pull all those people together into a team to complete this assessment, and have them bring their individual expertise to the table to help you complete this. And I think it'll be a better, more accurate reflection of your capacity as an agency at this point. The second thing is that team actually is a really good team to continue to work together as you make this transition to managed care. So, one of the kind of anecdotal or the unintended consequences of this assessment is it really does actually provide an opportunity to pull together a team which actually can continue to work together on the transition to managed care. So just to keep that in mind, not to do this in a vacuum and not to have one person pull this together. I think that's really, really important. And then ultimately, this assessment can be used as a roadmap for your agency to make the transition to managed care. The only other thing I would say here as well as you fill this out is to think about, if you're kind of in one part of your organization is, we work with children, we haven't made the transition yet, but you have an adult division, or you have some other division or a primary care division in your agency that's already made this transition to managed care, please involve them in this process. They have already gone through this. They know how to do this. They have figured a lot of these things out, and approach this as an agency and not just as the individual part of the agency, which is working on this transition right now.
Thanks, Andy, for providing that framing for this conversation. So now I'm going to get into some of the details of the OSA and provide some logistics and recommendations to really ensure that you guys are doing the best you can to submit it on time by the deadline of October 12th, but also that you guys have all the tools that you need to do that. So first, I want to just highlight that the Managed Care Organizational Self-Assessment, which I may refer to as the MIC OSA for short, was sent out on Tuesday, September 25th around 5 p.m. And that was sent to leaders of the organization. So that should be in the inbox of those people who have been in contact with the Office of Mental Health, which Claire mentioned. But if you did not receive it, and there may be many reasons why you did not receive it, sometimes there's a firewall on people's inboxes, sometimes it goes straight to spam, please feel free to email us. We're happy to send you the link to the OSA. I will also highlight here that each agency has a unique link for their OSA. And the reason why we do this is because it really provides an opportunity for people to revisit the assessment, save their work, and then visit it again. As Andy mentioned, we really are encouraging folks to do this in a team setting collaboratively. So we found through our past experiences that this is really the best way to ensure that folks can have continued conversations around the questions and domains that are posed. But before you begin the OSA, we do have some resources. So first is the instructions sheet. So we're going to provide a link to that in the chat box, so you'll soon be able to see that, and you'll be able to bookmark that as well. Instructions guide outlines the purpose again, some key steps we encourage folks to take, again highlighting this team approach that we do hope that agencies are able to do, but also highlight those particular members who we think can really make up a team that can successfully complete and submit this assessment. So we actually provide that by outlining the domains and who we think may best be suited to answer some of those questions. So that's listed in the instruction sheet. We also will provide and have provided a hard copy of the assessment. So if folks do want to walk away from a computer screen, really sit around a conference room table and really discuss some of these questions in detail with other agency members, then this really provides an opportunity to do that. The hard copy outlines the survey just as you would see it on the online platform. So some additional logistics, and just highlighting again that there is an opportunity to save your work as you go along. The questions of the survey are enforced, which means that we do ask that you respond to each question. And the questions, there are a few different types. So we have yes or no questions. We have questions that do ask for a little bit more information in the text box format. And then we also have questions that ask for a 1 through 5 scale response. So really assessing what you perceive your level of readiness being. And those questions are, again, all outlined in the beginning of the online assessment. And then submission can be done, again, directly from the online platform by the deadline October 12th. And then, again, just reiterating some of the things that Andy mentioned already, we will be providing individualized reports based on your responses. And we will also have a webinar in November that provides an aggregate the aggregate results from this round of assessments with the critical access providers. And again, just a note that the assessments will be shared with our state partners. The results will be shared with them since it is connected to the critical access provider funding. And I want to reiterate here that MCTAC is a resource along the way, so please feel free to email us at our .info account, mctac.info@nyu.edu, and we will respond to your questions in 1 to 2 business days, and we'll be sure to connect you to the correct people so that you can submit your organizational self-assessment on time.
Hi everyone, Claire again. Just a brief note about the strategic transition plan that we've mentioned a couple of times so far. That is not going to be due until December 31st. However, you will be receiving the template in early October when your first payment installment is sent out. We want you to have it so that you can kind of get a sense of what it looks like, how long is it, how much time are we going to need to spend on it, as soon as possible, so you have plenty of time and it's not a rushed process. We can let you know now that the domains really mirror what is in the organizational self-assessment. So again, when you're filling out that strategic transition plan template, it'll be sort of a culmination of doing this assessment and having these in-depth training discussions with MCTAC. And that will, by the time you're going to fill out the strategic transition plan, it should reflect conversations that you've already been having and questions you've already been asking yourself. The goal is not to give something that's super long or very, very time-consuming. The goal is to just make sure that you've got a plan in place going forward. And in terms of using, the remaining funds that you'll receive, as long as they're connected to the strategic plan, will be good to go. So that'll be the place where you really want to make sure that you're outlining the agency's needs for this transition and the activities that will need to take place, and then you can use the remaining funding to get started on those. So while that's not the focus of this webinar today, that is sort of the end product, so we just wanted to make sure that we mentioned it now. And that's it.
Sorry about that. I had everybody on mute. No, I had everybody on mute, but I was talking very articulately with everybody on mute. Okay, so I just want to highlight that we have done a number of these OSAs, and I think to just reiterate a couple of the things that Brianna said that we've kind of learned from our experience. I think the way to make sure that this is the most accurate representation of where your agency is really to highlight, to pull together a team and do this with all the relevant stakeholders in your agency, including IT and QA and programs and executive management and finance. I think that's really critically important. The other thing that we've seen is, and this is a little more anecdotal, but I think is important, is the agencies that have seemed to have made a successful transition to managed care are agencies that have had that team then ultimately take responsibility for the transition as a whole. And so I just wanted to say that one of the things that we've kind of seen from this experience that we've had doing a number of these assessments. So just to highlight that as well, I think we've already talked about the benefits of doing this before, so I won't go into that. But just really, really do this as a team. Don't have somebody do this individually. It's the single biggest thing that we've seen has been helpful, not only in the completion of this assessment, but also in the transition in general.
Great, thanks, Andy. And again, just here to highlight some of the domains that both Claire and Andy have highlighted. These, again, are just critical areas of importance that we feel that bringing attention to them now will really help bring success to the transition that agencies are going through to Medicaid managed care. And then just a quick note around data collection and analysis, and we have mentioned this already, but just want to kind of reiterate here. Data will be submitted through our online Qualtrics system, so you'll be able to do this through the unique URL that each agency has received. Data will be analyzed and collected, and again, we'll provide individualized reports that will really help agencies begin to assess and examine their readiness and preparedness for the transition to managed care. And we'll be able to identify particular areas that need additional support for the transition. Again, we'll have an opportunity to talk about the aggregate data and the results through a webinar opportunity. And then all of this will be followed up with targeted TA opportunities. And then here I just want to bring attention, again, to some of the tools and resources, and all of these, again, are outlined in the instructions guide that you have access to through the online link. So we have here a glossary of terms, which really is just to help folks, if there are any words or acronyms or terms that are unfamiliar, that this is a great resource to visit. We did our best to highlight and define the words that we felt needed to be defined throughout the assessment. But if there are any that you are unfamiliar with, this is a great resource to look to. We also have a couple other resource guides here that, including the PEN guide, which stands for Prepare, Evaluate, and Negotiate. This guide is really just to give you a look into some of the steps that you can take when you begin to think about building a relationship with managed care plans. And then some of these other tools as well are for a bit later on in the process, but we feel that it is helpful just to get a sense of kind of where we're going with the transition. And lastly, I want to just highlight, again, the timeline and our next offerings. And we have received some questions to the chat box around some confusion around dates. So I want to reiterate here that the deadline for the MIC OSA is October 12th. Previously, we said it was October 10th, but we have extended it because we did send out the assessment one day later than we anticipated. So we wanted to give some flexibility to providers to submit the assessment. So again, just starting off at the top, the assessment was actually sent on September 25th. So appreciate everyone's flexibility in that. Today is the 27th, and we are having the tips for completing the MIC OSA webinar. And 1 week from today, we'll have office hours to answer any outstanding questions that providers may have. The deadline for submission of the OSA is October 12th by end of day. And then by the end of October, we'll have distributed individualized reports, and then we'll provide continuous TA opportunities throughout November. And then the deadline for the strategic plan submission is December 31st. Okay, so with that, I'm going to turn to some of the questions that have come in. One question we have is just to asking about the slides. So the slides, the link to the page that will include both a PDF to the slides as well as a video recording of today's presentation will be sent out via email to all participating providers in today's webinar as well as those who have registered. Given that this is a mandatory activity, we will ensure that everyone has access to that link. This question is for our state partners. How many agencies are receiving these funds?
This specific set of readiness funds has been made available, again, to all current OMH intensive care coordination and OCFS healthcare integration agencies. That list is about 44 total. For this, there's other sets of readiness funds that we have outlined on different webinars, but for this set, it's about 44.
Great, thank you. Next question I have here is, I've tried to print out a hard copy of the MIC OSA and it stops at the question on your organization knows which Medicaid managed care plans are active in your area. Is that the last question? Let me revisit that question. I will make sure that the link that you have is properly working. Apologize for any inconveniences that may have caused, but let me revisit that and we'll make sure to include in all future correspondence the link. It could be a browser issue, but I will look into that after the webinar. The next question that we have, if you haven't received the MIC OSA, exactly who should we email? So please email mictac.info@nyu.edu, and we will make sure that you do receive the link to the OSA. Again, it is a unique link, so each organization has its own assessment to complete. They're all the same assessment, but they are individualized links. A question for the state, when are funds distributed?
That is a great question. So the funds will be distributed in 2 installments. The first is $10,000, and that will be distributed, I don't know the exact date, but early October, once we have received the formal acceptance of the funds through the OMH email box, and we can confirm with Miktex that your agency has attended this webinar. We will work to send out that first round of funding. The last installment will be the $15,000, and that will be upon completion of all of the rest of the activities. So once we see that you've completed and submitted the MIC OSA, participated in the trainings, and submit your strategic plan. So probably early in 2019, January 2019, depending on when we get all of that from you.
Great, thank you. And another question for the state. So since the office hours on October 4th are for questions only, is this a mandatory activity?
It is not a mandatory activity.
Great.
We hope that folks will start to work on this with their teams internally soon, because everyone's so excited that you just can't wait and you're getting started, and that there may be, you know, additional questions that you might not have now, but once you actually get started, you know, you might come across some more questions. So that's why we're having that offering. But if you don't have any questions, you do not need to attend.
Thank you. Another question. When we complete the agency assessment, does that represent our agreement to participate in this funding program, or do we need to submit something separate with our consultation/planning team?
The acceptance of participating is truly just sending an email to that omh-mc-children@omh.ny.gov email address and just saying, yes, agency name agrees to participate, and here's the people that are going to be working on it. That is the only kind of formal acceptance that we need.
Great. Another question for the state. Are the funds only to be used for the planning staff or consultants, or can it be used to address some of the deficiencies noted in the assessment?
The latter. We are hoping that agencies will be innovative in the use of these funds as long as they can clearly delineate that it is being used to support their strategic plan. Then it can be used for, it could certainly be used for a consultant, but we hope that it will start to be used for some of those activities to support the transition as well. Great.
This is a question for everyone on the webinar, Andy and the state included. Is there any plans to provide some TA specifically related to the intersect between this initiative and 29I, particularly important to B2H HCI providers?
I'll take that. Yeah, so we're having conversations with OCFS about the intersection of these providers, and so there'll be more information about that soon.
Great, thank you. Another question relating to the email that folks can reach out to. So it's on the current slide. It's Miktex, mctac.info@nyu.edu. We received another question around a hard copy of the assessment. So we will ensure that that link to the hard copy of the assessment is provided in a couple different areas. We'll make sure to include it in our follow-up correspondence with the link to the recording and the slides, and we'll also be sure to include it on the training page that has the recording and slides. We'll include it in the description so folks have easy access to that. The next question we have here is, do we have to submit proof of how monies are spent, and how would we have to give any of it back?
Great question. So we'll be distributing, with the first round of funding, you'll be receiving a detailed letter, but we will be asking for folks to fill out an expense reporting template to illustrate how the funding was spent, and save relevant receipts or whatever to kind of prove that. And then I believe that we will be, I know that we will be providing instructions in that letter on how to return unused funds, but I think we're still clarifying exactly how that will happen, but there will be instructions in the letter that comes along with the first installment about that.
Great, thank you. Our next question, will we have to submit a budget like we did with prior VFCA Medicaid readiness funds?
We're not looking for a budget per se prior to the money being spent. Really, the kind of the hard copy things that we're looking for are, did you attend this webinar? The submission and completion and submission of the MIC-OSA and the strategic plan, the attendance in and participation in the trainings with MICTAC in November. Those are really like the things we're checking off the list. And then you'll submit to us your expense report that will describe how you spent the money and how it relates to your strategic plan. Clearly, if it's something like, we decided to, you know, buy a boat or something that's so obvious, then we'll come back to you and say, can you provide more detail on how that, you know, directly relates to your strategic plan? But otherwise, we do want you to be innovative with the funds, and so we're not going to be requiring a budget prior to that final expense report. And if you have any questions, or is this allowed? Are we allowed to do this with the funding? You can always ask us along the way. We want to be working together. We don't want there to be any confusion. So we can definitely be in touch about any individual questions.
Thank you. We have another question. Could you please redefine who is eligible under the critical access provider category?
Yes. So your agency is eligible to receive this funding based on the type of provider that you are. So current OMH Intensive Care Coordination, or ICC, or OCFS Healthcare Integration, HCI agencies. So if you got the letter, then you're eligible to receive this funding. It's not a formal definition. So if you've received the letter, you're eligible. And if there's any individual questions, again, feel free to email. I'm wondering if our MICTAC partners can put in our OMH email address into the chat box as well. If you have any specific questions for us, it's the omh-mc-children@omh.ny.gov. Many of you have been emailing, so that's great, but we're also a resource.
Okay. Thank you. Another question that we have received, just to clarify, can we print out a blank version of the entire assessment? And yes, we will provide a PDF of a blank version of the entire assessment, which we'll be sure to make available to everyone in a couple different locations, so you're able to access it easily. And Claire, do you mind just repeating the email address one more time, the OMH box email address?
Yeah, it's OMH-MC, or managed care, children@omh.ny.gov.
Great, thank you.
It's also in the letter that folks received about these funds initially.
Great, and I'll add that to the chat box right now. Those are all of the questions that I currently see. Oh, I'm sorry, I just missed a few. Let's see. Is there a specific time frame for the expenses? Excuse me.
We will ask that the expense report is sent to us by the end of March 31st, 2019. So there is a time limit around this, so we are hoping that the funds are spent by March 31st, 2019. Someone actually asked me yesterday the same question, and they asked, will we be following up like a year later to check in on the funds, or what kind of follow-up is there? And right now, we don't anticipate doing that. Getting that final expense report will kind of be the end of it.
Great. Another question, how will the installments be paid?
They'll be paid, for the first installment's $10,000, the second's $15,000, and they'll be paid through a voucher.
Great. Another question. We have OMH waiver, SPA/HCBS designation, and we are applying for OCFS Article 29I. Which program will I relate to in my strategic plan?
So the strategic plan is for your agency overall. So if you're going to be doing, both, then that's great, and that will be a unique feature of your agency that you'll want to explore through this work. It's not necessarily that all this work has to be related to just the OCFS side or just the OMH side. It's really for your agency to make sure that you're able to smoothly transition into Medicaid managed care.
Thank you. So another question that has come in, if it ends March 31st, can we include expenses that start now?
I'm going to have to take that back. I'm not sure how that works in terms of I would think staff time right now that you're watching this webinar, that might be something that's okay, but I'm going to have to just take that back to the fiscal people and let you know.
Great. So those are the questions that I see. We'll leave the chat box open for another minute or so if anyone has any remaining questions. But while we wait for that, I'm going to move on to the next slide, just again to highlight that we are offering an office hours webinar next week, same time, 2 to 3. The registration link is here, so please feel free to register at your earliest convenience. We did just receive another question. Should we also include activities related to OPWDD readiness?
I'm sorry, Brianna, can you please repeat that question?
Sure. Should we also include activities related to OPWDD readiness? So there was some confusion that we had received through our email box too, because I believe that OPWDD providers were also doing a readiness assessment. So this is separate from that. Again, I think we're really looking at your agency being able to transition children that you're currently serving and potentially taking on new children to have a smooth transition to Medicaid managed care. So if that includes, you know, some of the OPWDD work, I think that would be okay. But if you have more specific questions, again, happy to do some email follow-up on that.
And I'll just jump in here, and Brianna, please correct me anything I say wrong, but I think also those assessments are very similar. So some of the questions are exactly the same, and I would anticipate that you would answer, as I mentioned before, I think it's really important to think of this as an overall agency in your readiness for the transition. So if you're engaging in transition activities for OPWDD, you're also engaging in activities around your mental health programs. I think all of that should be taken as a unit, and you shouldn't think about this as like segmenting off different parts of it as you fill out the assessment. With regards to the funding, that's a very separate question, but as you fill out the assessment, I think it's really important to think about the agency's readiness for managed care, because those same, you know, it's going to bill OPWDD for managed care is going to be the same as billing mental health for managed care, and so it's really your readiness to do those activities. So I think about it as an organizational thing, but again, let me just be very, very, very clear. That's very different than using the funding in this. I'm just talking about completing the assessment.
Great, yep. Sounds good. We have one additional question that has come in. In domain 1 of the assessment, question 2, is the denominator the entire agency's revenue? So this is a question relating to the percentage of revenue that's coming in from different insurance plans. Andy, do you mind answering that question?
Sorry about that. I just put you back on mute. Yeah, so the question is the denominator. What we're trying to do is get to 100%. So it's you know, it's of all of your programming, what percentage of it is managed care versus the other types.
Great, thank you. Okay. So with that, we will conclude today's webinar. Again, here is our contact information if you have any questions. You can also visit our website, ctechny.org, to access some of those tools and resources that we've identified during today's presentation. And thank you again for joining. We'll make sure that you all have access to the webinar slides and presentation recording in 2 to 3 business days at most. All right, thank you, everyone.